please.
Thank you. Good morning, dear Biljana, dear Goran, Mr. Rang, President Spano, dear judges, participants present here, but also in cyberspace. This is kind of hybrid meeting we have to bear with, but at the same time, I would say extremely important that we still have energy and possibilities to meet and to exchange views and to talk about such important issues affecting our societies in the Council of Europe region and beyond as well. In a crisis like the one we have been experiencing, member states' commitment to human rights are put to, I would say, most stringent test. Many countries have introduced, as we already heard by Judge Spano, state of emergency, and some resorted to derogations under Article 15 of the European Convention on Human Rights. Various restrictions to the rights and freedoms guaranteed under the European Convention, in particular freedom of movement, have been put in place in order to fight the pandemic and prevent the loss of lives. These measures may have raised human rights concern under several articles of the European Convention for Human Rights, which I understand will be a focus of your discussion in the next day and a half. I'm, as you know, mandated to foster the effective observance of human rights by Council of Europe member states and to point to shortcomings in the law and practice concerning human rights. So in a way, in this room, but probably because of presence of many judges and lawyers in cyberspace, I'm kind of intruder here, but it goes with the mandate and also the way Commissioner is pointing out to the shortcomings when it comes to violations of human rights in the time of normality, as we call it, but also in times of crisis. From the very outset of this crisis, I used my mandate to raise awareness about the risks that the measures adopted by governments could pose to human rights, and especially to those of certain groups of people whose rights were already largely neglected even before the pandemic. So I think the pandemic was in a way a magnifying glass when it comes to human rights violations in many member states of the Council of Europe. One of my first observations was that the crisis has laid bare certain pre-existing conditions that have made our societies more vulnerable. It worsened existing inequalities, making those who were already poor even poorer, and putting those already disadvantaged in an even less favorable positions. Women, older persons, refugees, migrants, the Roma, the homeless, prisoners, persons with disabilities, LGBTI community, refugees. These are just some among the groups whose rights have been particularly affected and at risk during the current crisis. Now I would like to mention a bit more about human rights of older persons and also boosting intergenerational solidarity. The ongoing outbreak was particularly dangerous, and it was particularly visible that older persons are really affected more than other parts of the society. It has had a disproportionately negative impact on their right to health and other human rights. The already existing social isolation of older persons has been exacerbated by lockdowns, which have reportedly taken a serious toll on their mental and physical health. I have stressed that all our societies must find novel ways of boosting intergenerational solidarity and social contact with older persons without putting them at risk of infection. So we have to look at lessons learned during this period and to see in this period ahead of us, have we learned something? Are we going to change something when it comes to our approach to older persons access to health, but also mental well-being. I have seen the proliferation of hate speech against various groups, including older persons, as a sign of growing intergenerational resentment. I was particularly concerned about the situation in large institutional settings for the long-term care of older persons where they are confined in close quarters. Even without the threat of deadly virus, such institutions often generate numerous human rights violations, including abuse and ill treatment, notably due to the failure to use a human rights-based approach in the design and delivery of long-term care and chronic lack of resources. This crisis brought home to urgency of overdue social care reforms which eliminate the root causes of this tragedy. This means in particular transitioning to long-term care systems which are centered on older persons' human rights, autonomy, and dignity as well. Persons with disabilities were most at risk to suffer human rights violations during pandemic. I will now share several assessments that me and my team concluded after several months of confinement and pandemic, and also while talking to NGOs and many that were affected during this period. Most member states rightly imposed social distancing measures to reduce the spread of the virus, but they have not been systematically attentive to the specific needs of persons with disabilities. In this context, I recall the state parties' obligation under the UN Convention on the Rights of Persons with Disabilities, CRPD, to take all necessary measures to ensure the protection and safety of persons with disabilities in situations of risk, including situations of armed conflict, humanitarian emergencies, and the occurrence of natural disasters. I also called on member states to address the growing risk of disruption to essential support services for persons with disabilities. They must ensure the continuity of the services persons with disabilities rely on, including by protecting social workers, in the context where life-saving healthcare resources are under increasing strain due to the pandemic. Member states need to address persons with disabilities concerned that they will be left behind in accessing life-saving interventions. The need for transparent and accessible information regarding the pandemic and measures to counter it had been particularly important for persons with disabilities. I praised a number of member states for positive examples of several countries who made efforts to provide persons with disabilities with information, including by creating dedicated information for them or providing information in easy-to-read or sign language versions, and the important work done by national NGOs in this domain. Finally, many persons with disabilities are still deprived of their liberty in large residential settings, including institutions and psychiatric hospitals, in contrary sorry, this is difficult with the mask. In contrary with international standards. The health crisis starkly highlights the need to make progress with the deinstitutionalization and the creation of community-based services which allows them to live independently. In the short term, however, I have called on states to reduce risks by stopping new admissions and moving people with disabilities out of these institutions as much as possible. But this is not new. This is something we've been calling for many years. Council of Europe was really the organization that put enormous efforts in order to make sure that this is an issue that shouldn't be neglected. During pandemic, it really shows that not much has been done. When it comes to human rights of women, I would like to mention several things that were extremely important during pandemic, but also extremely worrying. Judge Spano mentioned violence, domestic violence. I will mention something else in addition to this huge problem. It has become clear that the pandemic will deepen existing gender inequalities due to women's overrepresentation in professions which expose them to a high risk of infection and in low-paid jobs, which will be particularly badly affected by the ensuing economic crisis. Gender-based violence has increased, and while the health of women generally is adversely impacted through the reallocation of resources and priorities, including sexual and reproductive health services. I have been concerned about the negative impact of restrictions imposed by European governments on access to essential sexual and reproductive health information, services, and goods for women and girls. The situation has been particularly worrying for women and girls who live in the few European states where abortion is still illegal or severely restricted, and who cannot travel abroad to seek assistance and care. But even in the states where abortion is legal, pre-existing obstacles, such as mandatory waiting period, counseling, as well as unnecessary hospitalization, widespread refusals of care on grounds of conscience, and the limited use of medical abortion pills may become unachievable in effectively accessing time-sensitive services. And this is all in addition to pandemic affecting societies, affecting families, affecting well-being of each and every society within the Council of Europe. However, some states have taken encouraging initiatives facilitating access to abortion care and contraception during the lockdown. In a human rights comment I published in May, I gave a number of recommendations for Council of Europe member states on how to uphold the human rights of women in the pandemic, ranging from steps to be taken to protect women victims of gender-based violence, improve access to reproductive health care, and support women's rights defenders. Moreover, services providers such as healthcare staff, shelters for women victims of violence, family planning organizations, and humanitarian assistance need be able to continue playing their important role in assisting women during the pandemic. Combating dispersal of disinformation is also an issue I would like to mention briefly. Combating dispersal of disinformation that may cause panic and social unrest is necessary to effectively fight pandemic. However, in some Council of Europe member states, including several countries from the region, governments adopted decrees or decisions that clearly risk hampering the work of journalists and media actors and restricting the public's right to receive information. For example, in Bosnia and Herzegovina, decrees and legislative proposals aimed at punishing the circulation of information that can cause panic run the risk of limiting the work of journalists and freedom of expression on social media platforms. And in Serbia, there were reports of cases of journalists who were prevented from attending press conferences, obtaining information from health authorities, or documenting the operations of law enforcement officials, to name some of the examples from the region. I have made it clear in a statement that I released in April concerning this issue that timely information is absolutely essential for the public to understand the danger and adopt measures at a personal level to protect themselves, and those measures risk to undermine of this important process. Another important issue I addressed relates to the protection and safety of journalists that I already mentioned, so that they are able to work under safe conditions without fear of being harassed or attacked or imprisoned, which unfortunately has happened to some journalists reporting on the pandemic within the Council of Europe area. I urged all Council of Europe member states to preserve press and media freedom and ensure that measures to combat disinformation are necessary, proportionate, and subject to regular oversight, including by Parliament and national human rights institutions. I already mentioned LGBTI people, and they were particularly disproportionately affected by the pandemic. The LGBTI community in general may be particularly affected as a result of the pandemic, given that they are disproportionately represented in the ranks of the poor, people experiencing homelessness, and those without health care. This was noted in a joint statement that I published together with the Inter-American Commission on Human Rights, UN Committee on the Rights of the Child, and the UN Human Rights Experts on the International Day Against Homophobia, Transphobia, and Biphobia last May. We noted that while contributing to the fight against the pandemic by staying at home, LGBTI children, youth, and elders are forced to endure prolonged exposure to unaccepting family members, which increased rates of domestic violence and physical and emotional abuse, as well as damage to mental health. All of this is documented by numerous communications of my office, but also other human rights body, international organizations in their work with NGOs working in this area during the confinement and also in this period afterwards. In many jurisdictions, LGBTI persons, particularly those most impoverished or without proper documentation, rely overwhelmingly on informal economies made impossible by COVID-19 restrictions. We called on states to pursue all means necessary, including research, legislation, public policy, and also ensuring access to justice mechanisms, to ensure that this public health emergency will neither increase existing prejudices, inequalities, or structural barriers, nor lead to increased violence and discrimination against persons with diverse sexual orientations and gender identities. We also urged all stakeholders, particularly states, to urgently implement lines of action designed to sustain and ensure the continuity of the work of civil society and human rights defenders. The capacities existing within this sector must not be put in peril. And unfortunately, this is what happened during the confinement. This is what we experienced, but in many Council of Europe member states, this was the sad reality. The situation of refugees and migrants, including asylum seekers, COVID-19 has also affected negatively the operations to save migrant lives at sea and disembark survivors in a safe port. I'm sure you were all aware of the news coming from the Mediterranean and many parts of the world. In response to the COVID-19 emergency, several measures and practices have been adopted by some member states, which have led to the closure of ports, to NGO vessels carrying rescued migrants, and to the discontinuation of activities to coordinate rescue operation and disembarkation of those in distress. This has further aggravated existing gaps in such operation in the central Mediterranean, and I called on Council of Europe member states to promptly respond to any call of distress at sea, deploy the necessary rescue capacity in a timely manner, and effectively cooperate to identify a place of safety where survivors can be disembarked, taking all necessary measures to protect the health of all involved. At the end, I would like to briefly mention another issue which I think is of importance for your work and also for the discussions. It is related to data protection concerns. This topic has been widely discussed in several member states, and it is also a concern of the use of digital devices to help enforce quarantine orders, track the progression of infection, or inform people about their possible exposure to infected individuals, and the processing of personal data in this context. For example, in Montenegro, the government published on its website at the very beginning of confinement process the names and the addresses of the people who have been ordered to self-isolate upon their return from abroad. In an opinion editorial that I published last May in several national media outlets, I cautioned against the data protection risks that such tools would entail. I recommended a number of steps for member states to ensure that such tools are introduced only if they are designed and used in a way that respects democratic rules. It is a huge challenge for each and every state, but this is absolutely a must for any democratic society. These include, first, that digital devices must be designed and used in compliance with privacy and non-discrimination provisions. Secondly, laws governing these issues must comply strictly with the right to privacy as protected by the laws of national constitutions and of the European Court of Human Rights. Lastly, government operations must be subject to judicial review, as well as monitoring by Parliament and the national human rights institutions to ensure accountability. And independent data protection authorities, they must test and approve technological devices before they are used. The way forward. This crisis has increased, as I already stated, the existing shortcomings in our human rights protection system in Europe, but also beyond. However, given the nature and the scale of restrictions to which millions of Europeans have been and continue to be exposed, awareness of human rights among citizens has grown. This is a good thing. National human rights structures, NGOs, and human rights defenders have quickly adapted and are better equipped to the situation and continued carrying out their important human rights work. As the fight against pandemic continues, a new, or we can call them old, restrictions in many European countries seem unavoidable, I would like to highlight several elements that should be part of government's future decision-making in this context. We need, first of all, more solidarity. We need more solidarity and more unity in Europe. In the early stages of the pandemic, measures taken by European states in response to the current crisis has frequently been characterized by self-centered approaches designed to protect own population, even to the detriment of others. Sudden border closures, in addition to this, buying up or intercepting protective gear deliveries, the frantic struggle to secure own vaccine stocks were only some of the examples. Quite embarrassing, I would say, examples. The situation has shown the need for improved multilateralism, as well as more solidarity and cooperation between states, more trust, more wisdom, more courage. We have seen that no single country can on its own solve the complex human rights challenges created by the current health crisis. And this is where we come into picture. We, when I say we, I think of Council of Europe, with all the network that we have and all mechanisms that we have at our disposal, including the presence of the European Court of Human Rights. So these mechanisms should be used and not neglected in times of crisis. Secondly, governments need to uphold the independence of judges and the judiciary, which is absolutely essential to the observance of human rights. Even though judges remain at the service of citizens and continue to be involved in human rights matter, COVID-19 has affected the functioning of the courts in many countries. It is therefore all the more important for citizens, human rights defenders, and legal professionals to remain alert and reactive to any government's attempts of using a health imperative to roll back on human rights, and we know that there were many examples. Thirdly, transparency and accessibility as key values which increase the public's confidence need to be upheld by governments. Timely access to reliable information is also absolutely essential for the public to understand, to learn the risks, and to adopt new own protective measures. Therefore, governments need to ensure that their communications on the crisis response reach all people, and it's understandable. The digital tools used to monitor and track citizens must comply with privacy laws, and balance needs to be struck between the argument of health protection, however weighty, and an individual's right to privacy. So all in all, not easy, extremely challenging, but at the same time, extremely important. The pandemic revealed many gaps in national human rights protection systems, and these gaps should be addressed at a national level in line with the principle of subsidiarity. I believe that the guide that was already mentioned by Judge Spano on the European Convention on Human Rights in the time of COVID-19, which was published today by the AIRE Center and Civil Rights Defenders, provide a very useful guidance for governments, legal professions, and the NGOs to that end, and it should be used and implemented. Thank you very much, and I apologize for a bit of a problem with this mask, but we have to live with this. Thank you so much.